afternoon. So we are now going to do a cybersecurity panel discussion that will be shared by the Chief Security Officer of DHS Wales, and I'm pleased to introduce. I get my Chief Information Security Officer of and Head of Profession for Cybersecurity at Digital Healthcare Wales, responsible for implementing and running the Enterprise Information Security Program across NHS Wales. This involves identifying, evaluating, mitigating, and reporting on legal, regulatory, commercial, digital, data, and technology risks in a cybersecurity context while enabling and advancing business objectives. This is very important. It's really a pleasure to have you here, Mark, and for have you taking time off your busy schedule to be here with us. And thank you for sharing this panel discussion, and over to you.
Fortifying health data. And sorry, as we were warming up, I was sharing reflections from my last NHS CIO role, where I was both the chief or senior responsible owner for data and the director responsible for major incident planning. So I had to plan to make sure things didn't go wrong and then plan for what happens when they did. Yes, obviously good to get all the panel reflections. Just the quick introductions. Mark has been kindly introduced already by Paul. David, thank you again for joining us, following from yesterday. So Acting Head of Welsh Affairs at the Information Commissioner's Office. And if I can also introduce Abul Ahmed to the room. So Abul is Principal Consultant CISO for Atos. First question, if I can actually come to David, if that's right. So I suppose a quick perspective on the sort of current regulatory view of cyber.
Okay. Apologies to all those who had to put up with me yesterday, and now we're having to do the same again today. I feel like I'm hogging these sessions a little bit, but it does show the wide range of work that we do. So cybersecurity is quite frequently a component of information security, which goes around, which has to secure the personal data that we hold. When it goes wrong, that's usually when people come to us, but we do loads of things like this to try and get the awareness up and make sure everybody's aware of it in beforehand. And certainly for cyber, it's been really interesting over the last few years, I think, to watch it become part of the national conversation. It's moved from a niche aspect that only certain people and nerds like me know a little bit about, and it's moved more. I think it was yesterday. There was another cyber breach yesterday involving a nursery. You may have seen that story. That's a very live one. Jaguar Land Rover, Marks and Spencers this year as well. These are all things that are huge, and I think ransomware is one of the key issues as to why they've become, because they can do so much damage to such a wide range of businesses as well as customer bases, and that's certainly an aspect of what we've seen as well.
Well, thanks, David. And Mark, if I can sort of bridge that over to you. So against that continually increasing threat backdrop, what's the role of the CISO and how's that evolved?
Okay, so that's a really good question. So very much when I first started my role, or started working as a CISO, senior security influencer, it was very much policy-based. Thou shalt not was our sort of motto. We controlled everything, just cybersecurity controls. Over the last couple of years, it's changed dramatically, the role, and now we've seen more as a business enabler. And you know, I come from a private background where I've done quite a bit of sales in my life, and I think my sales and sort of influencing skills are probably more important than my technical skills at the moment, because we've got to get buy-in from the business, and we've got to make sure that they can do what they want to do and do it safely, rather than stopping them from doing things that we don't want to do, while still remembering that we've got to protect critical data. And I think artificial intelligence is a great example of that, because I've never seen such a technology. I've been in the industry for 30 years, and it's just been an explosion of AI. Everyone's using it. All the youngsters are using it. All the staff members are using it, absolutely every level. And we can't stop it, and we don't want to stop it. That's all we've got to do, is make sure that we put in sufficient controls and education so that people can use technologies like AI safely.
Yeah, no, absolutely, Mark. And sorry, Dave, jumping back to you as well. So, I mean, it's an evolving picture, and I remember as a trust CIRO, actually appreciated the ICO not just as a regulator who was looking over my shoulder, but actually as a guiding organisation. What would you now say against that backdrop is the sort of recommended best practice that the ICO is putting forward to the provider organisations?
In many ways, it's a lot of the same messages from yesteryear. Train staff. There's that link between the human behaviours that then allow the bad guys, the bad actors into the data scene. Phishing is a great example. If you've got a member of staff who's going to drive a forklift truck, you don't just let them at it, but we do it with email and we do it with computers. You've got to train people and you've got to enable them to be able to spot the issues that are there. There's a raft of guidance that's out there. There's lots of good guidance on the NCSC website. We've got lots of guidance for smaller organizations usually, but the same rules apply to there. You've got to know what data you have. The list is endless really, but get the basics right and a lot of the rest will follow. And I think, as Mark says there, buy-in, that senior level buy-in, and it pervades down through the organization. That's where we see the most effective organizations in place, I think.
Mark, obviously great for us to get the support and the guidance from the ICO, but actually we're all facing these same challenges, aren't we? All the different organisations. What would you see as the way we can support each other through collaboration?
Okay, yeah, I think that's key, and that's one of the advantages we've got in Wales is that we're a small country, 3.1 million people, but we're big enough to actually make a big difference there. But it's small enough to collaborate, and I think that what we've shown is throughout the NHS in Wales, sometimes we don't collaborate as much as we can in technology, but that's probably an understatement. But when we do, we collaborate really well. And one thing we've done over the last year, which was put in place by my predecessor, was deploy a nationwide security information and event monitoring solution. So now we have a single pane of glass into all the threats that are affected the NHS in Wales and all the remediations we can do about them. So we can see through all organisations. Each organisation has their own dashboard where they can see key performance indicators and threats to their organisation, and then we can react as one to any of those threats as they emerge. And I think, to the earlier point was, it's in people's minds at the moment, the current threats. The one of great concern to me was the one yesterday against the kiddo nursery breach. And that, just show how low the cyber attackers can stoop. Because in the past, we think maybe healthcare isn't going to be affected because we're not for profit, we save people's lives. But this shows the 8,000 records of young children in nursery, and pictures of being stolen, exfiltrated, and they demanded a ransom to actually publish otherwise they'd publish those records to criminals, basically. And I've never known a security attack as bad as that. So, that's the reason we're all doing this. That's the reason we've got to collaborate together, and it shows that no one is immune from a cybersecurity breach.
No, I think it's a good point, Mark. And obviously, we often consider the cyber threat in terms of, and as with that, the threat to privacy, the threat to the record. Atos, in our broader work with other industries, we support an awful lot of critical national infrastructure of various nations. And of course, we've got to remember the NHS is that. If you wanted to cripple this nation, start taking out hospitals, they can't function. So it's a big step change in threat.
Yeah, absolutely. And I was at a conference last week, and it was very insightful. They said that even attacks on other critical national infrastructure or any major disaster in the UK, the NHS and the health service will actually be impacted from it. So we are a part of critical national infrastructure, whether we like it or not.
Thanks, Mark. Abul, if I can come to you. Obviously, I suppose moving down a level in terms of the detail, the last day and a half, or a couple of days, have been very focused in on our ability to share data. I was wondering if you could share your reflections on how architectural principles like zero trust can actually be an enabler to sharing rather than a blocker.
Yeah, absolutely. And it's not just new technologies like zero trust. We've also made tremendous advances in how we deal with cyber and the lessons we've learned, including how to simplify it. So it's not a bad news story, right? The attacks get worse, but we have new and better ways to deal with it. In terms of zero trust, that sounds really scary. It sounds like we're all going to have to authenticate every time we want to access something, and that can be really business disabling. But the way something like zero trust can certainly help us share information much more easily. And by the way, it gets rid of, if we use it properly, the idea that we have to have copies of information in a shared patient record, for example. If you try and access information in a system, you'll be challenged for your role, and then you'll be given access, that's role-based access control. I think we all know about that. Zero Trust brings in something else. It says, yes, we will check everybody's access to information more continuously, but because of new technologies, you don't have to keep signing in with your password. It will use different methodologies, such as attribute-based access control, which has been difficult in the past, but because we've got much better technology, faster chips, the information that it will evaluate you on is already there in the system, and it's being constantly collected. So when you log in, it will already have that information, and therefore when a consultant surgeon wants to access somebody's GP record, Zero Trust will be able to evaluate whether that surgeon can be allowed to access that record using other information about them.
Yep. Thanks, Abul. Aware of time, and I'm sure we want to close fishing, but so perhaps one last reflection from each of the panelists. And I referenced at the start my previous role that required me to be poacher and gamekeeper, in that I needed to make sure that people couldn't break in. That's an impossible task, they'll get in eventually. And perhaps therefore more critically, my role as the director responsible for major incident for trust. What do we do when it goes wrong? So certainly at that trust, I did a lot of work with my executive on practicing for when it goes wrong and how we would respond. Typically the scenario involved me being off on holiday somewhere, so I could actually run the event. But so I can go through each of the panel in turn, so perhaps start with Abul. So your reflections on how we make sure we are able to respond when something happens.
Well, the thing about responding to a cyber attack, luckily, even though we've seen so many incidents recently, for each individual organization, it will happen at some point, but it doesn't happen that often, otherwise we'd all be dead, right? So the thing is to practice and prepare. And so it's important to get into scenario-based practice with a third party, preferably because they can take a step back. They will run scenarios for you. It's a good idea to get all your execs, key people into a room. They will come up with scenarios. They won't tell you what they are. They will kick off these scenarios and then say, right, what are you going to do? And then they'll also build in other injections, such as, oh, we just had a news broadcast from the BBC. They're mentioning your company. You've just had a massive breach. Everybody's really upset. What are you going to do about that? It's just getting everybody operating in a controlled way to deal with that incident. And after you've completed it, you'll learn whether your processes are good, what needs to be improved, what doesn't.
Mark, same question?
Absolutely correct. So I've seen there's a big shift from just protection, detection, to resilience. So, you know, how do we respond in the event of a disaster? Because, as you mentioned, it is a case of when, not if, and I'm sorry to be pessimistic about it, but we've got a plan for that. And if it doesn't happen, great. But we've recently run an incident response exercise, an all-wheels incident response exercise covering exactly the same points you mentioned. And there's some great learnings for it. So we had all 13 organisations in NHS Wales collaborate in to do a third-party incident response. And some of the things that came out of there were absolutely, mind-blowing, really. And some ways we were completely covered, and other ways we discovered weaknesses straight away, such as out-of-band communication. So if we lose our Microsoft platform, how do we even communicate to do the incident response? So it's little things like that that we need to pick up on. And no one wants to get breached, but we have to make sure that we know what to do in the event of a breach. And I always think about, as well, we need to look at ransomware preparedness and how we counter specific threats like that. And if we were hit by ransomware, how would we deal with that? Because a lot of the protection we have in place will deal with traditional disasters, such as fire, losing a data center. But if everything is encrypted, and quite often your backups will be encrypted, sometimes you'll have a secondary breach as well. How do you deal in that scenario? It's a completely different scenario. And, we were supposed to have Health Executive Ireland here today to speak to us. And we've learned a lot from them, and their experience of a real incident. And it's in areas like that, they had their staff members going off in ambulances. So we have to, consider that, that the welfare and resilience of the staff members, as well as the resilience of our data.
Yep. David.
Well, we're the bad guys in the breach reporting chain, aren't we? Because we're the ones that can take action. I think it's worth. I mean, there's a legal duty, first of all, to consider whether or not there's a threshold, whether or not an attack meets the threshold. My advice is always to try and assess the personal impact, the human element, as quickly as you can. If you know what data you hold, you should be quite straightforward. As Mark says, I think it's inevitable. You probably, in the course of this conversation, our organizations have probably repelled hundreds of cyber attacks as we speak. And it's inevitable that, you know, a breach will happen at some point along the way. So being prepared for it, knowing where your disaster recovery is, as you alluded to there, David, then these things will really help that go smoothly. The sort of things we're looking for, keeping that rationale behind your decisions. Just to bring it to life, you may remember the advanced data breach, which we issued a monetary penalty for earlier this year for £3 million, and that was an NHS supplier. That supply chain is key. So again, monitoring that. How are you going to think of every eventuality that could cause a breach and have a real impact on people's lives?
Advanced being a supplier to one of my old trusts. So yes, absolutely. Wonderful. Well, I think we're probably closing down to move on to the next session. So may I ask everyone to join me in thanking our panel for the chat? And thank you. We'll pass back to Paul.
David, there is one minor comment from online.
Thank you so much, dear guest speakers, and a round of applause for David for this impeccable moderation. Please, David is being...
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation at a time.